name is Tamieko. I was diagnosed in December of 2010. I was stage 1 and stage 2 breast cancer. To date, I've had a double mastectomy with instant or immediate reconstruction. I was given tissue expanders and then moved forward on to the implant stages. I had chemo and no radiation. Currently, after my surgeries and everything, my now follow-up is I'm on hormone replacement therapy, and I follow up with my oncologist every 6 months for a checkup. And the hormone replacement therapy will last for 5 years. One of the biggest differences that I find working with the doctors here and the staff at Mayo is that this is a research hospital. Not only that, but all of the doctors are extremely informed, educated, and they really care about me as a patient, and not only as a patient, but as a person. All of my questions are answered to the fullest extent. Any follow-up questions I have, it's very easy for me to get in contact with them. They are just very good with forwarding on the knowledge and making sure that I'm secure in the information that they're giving me and the choices that I've made about my care. I think with some of the doctors that I'd seen previous to coming to Mayo that I felt rushed a lot with other facilities that I'd gone to. There was just so much information that I was given that I had to process, and that was just very overwhelming for me. Once I came to Mayo and I met with my plastic surgeon, Dr. Bash, she really took her time to ensure that I understood everything that she was explaining to me, that I was in agreement with the options that she thought were best for my particular medical situation, that she understood what path I wanted to go in, and that the path that I wanted to go in was right. Whenever I had any follow-up questions, she was very easy to get in contact with, and I just felt as though I was a member of a team for my care. I didn't have to idly sit back and let them make all the decisions. The options were given to me. They made sure that I understood what those options were, and any input that I had or any decisions that I wanted to make or any routes that I wanted to go in were always considered and were important to them, just as important to them as they were to me. How did I cope with the cancer diagnosis? I think one of the best ways to cope, at least for me, is understanding that how I operate in my personal life, how I operate in my professional life, is the same way that I wanted to operate with my medical diagnosis. I am a type of person that likes to have as much information as possible to help me make the best decisions, the best educated decisions. So understanding what works well for me is what helped me through this. Also, the staff at Mayo was so welcoming and supportive that also helped me through it. So if I knew what I had coming in front of me as far as the treatments and what to expect from those treatments, it helped me to better understand and deal with some of the more challenging issues that came along with diagnosis of cancer and the treatment of cancer and trying to get my life back in order. So I think the biggest coping mechanism that I used was to understand myself and to understand what things do and don't work for me, understanding that I needed a team of doctors that were not only the best, but also considered me a member of that team, that cared about me as a person, that involved me in all of the things that I needed to be involved with, but also took the reins and took care of me. So I had a team that I trusted, and once I was able to put that trust in them, it got a lot better for me. That was my biggest coping mechanism, finding doctors that I felt were strong enough individually, medically, and personally to help me through this difficult time, and that's what I found in the doctors that care for me here at Mayo. I think the biggest thing that I would share with other women going through this is to understand and accept that it's a lot of information to be presented with at one time, and it's very scary. Figuring out the support system that you have around you and being able to use that support system is the best way to help you get through this. Whether that support system be your family, your friends, your doctors, your colleagues, whatever, or yourself. If you find that strength in yourself, then lean on that, but also know that you don't always have to be strong because it's scary. There's going to be times where you just don't know what to do. There's going to be times where it could become overwhelming, but you have people there in your area, whether that be in hotline or some of the help areas within Mayo or whatever doctors you choose. There are organizations out there that can assist you, and women out there that have been through it that could help you. So don't feel as though you have to take that burden all on yourself, because there's others out there going through it that have learned from experience.